Hello, I'm Diana Gallagher, and I am a registered nurse with over 20 years of experience as a board-certified wound ostomy continence nurse. Today, we're going to continue our talk on Stimulen. Now, Stimulen, as we have discussed, is a hydrolyzed collagen. Now, there are a lot of them on the market, and you may ask, I use another one, why would I buy Stimulen? Well, the reality of it is, if you work in wound care today, the vast majority of the patients that we are seeing are chronic, non-healing wounds on our patients. By the very definition of chronic, non-healing wounds, we need Stimulen. You've got to have something to stimulate that normal cycle of healing, and that is what these products do. Now, unlike other companies that only offer a clinician one product, one formulation, one size to use, Southwest Technologies has been very good to work with clinicians and provide this hydrolyzed collagen in a number of different formulations. We have gel, we have powder, we have lotion, and we have some special combinations that are seen globally depending on what the market needs are and the requirements of a global environment. We also have Stimulen, the hydrolyzed collagen, in dermaceutical products, and we'll talk about those in a later segment. Now, it is very important to understand when you want to use Stimulen. If you've had a wound that has failed to show any significant progress toward healing for 2 consecutive weeks, 2 weeks, 14 days, that means that you need to change your plan. Now, if your clinic is like my clinic, you could go to your storeroom and pull out any number of products off the shelf. However, why would you want to use another product only to have failure? Only to have another 2 weeks of delayed healing? I contend that if you go to Stimulen after that first 2 weeks of non-healing, you are going to see a dramatic reduction in your time to healing and your clinic's profitability because you're not wasting time on things that don't work. I've always contended that doing the right thing first is always going to be your best choice and always going to save money. So, with the wound not healing for 2 weeks, go to Stimulen. Now, what form of Stimulen is really up to the clinician, because out of all the companies that I work with, Southwest Technologies respects the expertise of individual clinicians. And so if your wound is drier, you're going to want to use one of the gel formulations. But if your wound has copious exudate, you don't necessarily need the gel, and you could use a powder. And what I want you to do is to use the Stimulen to entirely coat the base and the sides of any of these chronic wounds. And I mean any. I don't care if that chronic wound is secondary to a burn, or to a venous insufficiency wound, or a pressure wound, or a trauma, or some other wound etiology that we're not even discussing because it's not one of the normal. Stimulen is going to be your best resource. My favorite, an absolute favorite, what makes my job fun is when I can use Stimulen on diabetic foot wounds and arterial wounds. We know the demographics. We live in a society that has an increasing incidence of diabetes. And sadly, when you look at the statistics, diabetes frequently has very poor outcomes. People lose toes, they lose legs, and they lose their life. If we can intervene properly with that very first wound, we can change that paradigm. And because we now know that Stimulen will grow new capillaries, we can help revascularize that wound that otherwise isn't healing because of blood flow. So, in those wounds, you may want to do gel or powder. If you are one of my clinicians in a foreign market, you may want to look at the products that have the glycerin added, like the Stimulen amorphous. This is not available everywhere, but where it is, it does give you a combination of both glycerin and collagen. And so for things like diabetic foot wounds, it is absolutely miraculous, because what do we deal with a diabetic foot wound? We deal with a polymicrobial wound that isn't healing because it doesn't have good blood flow. We have lots of wounds, and I am obviously speaking very clear English, hopefully, and I'm not living in a foreign country anymore. But I get the same results when I use Stimulen gel and Stimulen powder. So by taking your Stimulen gel and opening your tube and removing the safety seal tab, you can take with your clean gloved hands, and remember, wound care is primarily clean technique. You can either apply the Stimulen directly into a wound. Viscosity will be somewhat thick, and then using your gloved hand or an applicator, you can paint the inside of those wound surfaces. You can put Stimulen over bone, you could put Stimulen over tendon. It is not going to do any harm at all, and I want you to apply a thickness enough to really cover the base and the sides. If you have an area of undermining, I want to cover both the top and bottom of that undermined area. If the wound is a cavity wound, you have to adhere to good wound care principles, and you would then pack that cavity with an appropriate filler. And most of you already know what my choice of appropriate fillers are. That would be gold dust. And this wound should show significant improvement within that first 2 weeks. Now, if your wound was unusually dry, which of course we find more with arterial wounds and wounds on the distal extremities, powder may be our better choice. You can get powder either in the multi-use container, or you can get powder in the individual single-use packets. It is a very fine powder. You can sprinkle it in the wound, again making sure that you apply enough to adequately cover the base and extending it up onto the sides of the wound. And again, for cavities, you would then do a filler. If you have a variety of skin conditions, and let's be honest, if we work in wound care, we also work in skin care. And how often do we see rashes, irritations, skin damage because of a wound or because of skin problems all in and of themselves? You might want to use Stimulen lotion. Now, Stimulen lotion is going to have a higher level of glycerin. Glycerin is, if we go back to our chemistry, glycerin is naturally occurring in every cell of our body. And because it is going to help the Stimulen be readily absorbed into the cells, and it will be bactericidal and fungicidal. Now, where do I use Stimulen lotion? I use it in a lot of different places. But for instance, if I've got someone with a very dry, irritated rash on a lower leg, Stimulen lotion might be my first choice. If I have a woman who is very well endowed and has a rash underneath her breast, maybe even intertrigo, I might do Stimulen lotion with a secondary dressing of something like Elastigel to separate those skin layers and allow time for that rash to heal. Don't overlook this valuable product. If you would like any more information on any of these amazing products, please call Southwest Technologies. Their office and factory will be open Monday through Friday. You may call directly using